We have three main streams of service: healthcare, education, and housing.
When a family comes to CUPS, we sit down with them one-on-one to assess where their needs are and create a program for them.
What CUPS did was take the time to listen to my story, which a lot of agencies don't.
In the health clinic alone, we see 35,000 patient visits a year.
Things like medical, dental, a lot of that was really hard to access before I went to CUPS.
I had all 3 children through CUPS and the prenatal care, and all 3 children came out wonderful.
CUPS One World Child Development Center is an early intervention program that supports children and families living in poverty.
Not only are we helping the child's development, but we are also helping the parents gain the knowledge of the strategies that they need to foster this healthy development as well.
Being a single parent is very difficult, but I know that CUPS was able to make it easier for me. They made it possible for me to be able to get into a house where it was safe for my son and I.
CUPS Community Development Program is more than just affordable housing. It starts with making sure that rent is geared to income, but in addition to that, it provides a strong sense of community.
I love their housing program. You get to know your neighbors and you get to spend time with them. You build a community based on the people living here.
So that is our goal, to get more families and individuals to long-term stability that's well beyond just having a house and getting your basic needs met, but knowing how to handle life when chaos and stress hits again, which inevitably it will.
I haven't had to go back to the streets. They help us get on our feet so that we can be self-sufficient, to make sure that my children don't go through the same things that I went through.
Strong children that have a good foundation are a very good investment for society in general. CUPS is able to back up their results that show the actual contribution to the community that they're giving by helping these children at early stages and helping the mothers at early stages.
One of the things we know is that if we don't get involved and we don't break that cycle, these children will grow up and be seeking our services as adults. So in order to do that, we know that we need to look at the science, we need to learn from it, and we need to help these children build resiliency, therefore breaking the cycle forever.
The brain is an amazing thing, and when you understand how it works and how it's negatively impacted by early childhood trauma, then you can understand how to address that trauma and break the cycle of poverty.
We're helping them deal with the now, we're helping them explain the past, but most importantly, we're helping them to build stronger and healthier futures.
And here I am, years later, with a bachelor's of social work, working in the community, serving others, and being a voice.
Now I am becoming a healthcare aide to give back to my community, and it's the best feeling in the world to get out there and to be able to do that.
CUPS is funded 60% privately and 40% by the government. It's a good mix to have, but it's one that we strive every year to fulfill.
You can't really put a number on changing somebody's life, and CUPS does that.
That invested in my future and the future of my son, and I'll forever be grateful for that.
And we couldn't offer the services at CUPS without private donations from corporations and people like you.
For the difference you're helping us make, thank you.
Thank you.
Thank you so much.
Thank you for investing in my future.